Hi. Tyler and I did our family expo originally on the danger of how too much caffeine can affect your body, including your heart. But we also saw that there was a direct link between too much caffeine and too much sugar combined together that was causing a problem. So we decided to focus for our expo the dangers of consuming too much caffeine and too much sugar into your body and how it affects you. Caffeine and sugar are the two most common abused ingredients. Caffeine's partner in crime is sugar. Most drinks that people consume to help energize or wake them up contain caffeine and sugar. While these two alone have their own health risks when consumed in large amounts, it is when you combine them together that you can see some real or even deadly problems. Multiple reports have shed light on the consumption and danger of excessive caffeine involving the death of young teens dying by sudden cardiac arrest after consuming multiple drinks that contain caffeine and large amounts of sugar. If your consumption is spread out over the course of the day, it is still not healthy for you, but it does not carry the same risk of sudden cardiac death. It is when people consume multiple drinks containing these large amounts of caffeine and sugar in a short span of time that can send the body into a revved up fight or flight response that for some just cannot tolerate, leading to significant cardiac arrhythmias, which is arrhythmias that are not normal in your heart, or cardiac arrest.
The dangers of energy drinks and how they affect the heart. When people are tired, they often consume caffeine to help them have more energy. Energy drinks have large amounts of caffeine in them. Large amounts of caffeine can cause health problems with your heart and blood vessels that can lead to heart rhythm problems, increased heart rate, and increased blood pressure. Soda has around 35 milligrams of caffeine. A cup of coffee has around 100 milligrams of caffeine. An energy drink in a can has up to 240 milligrams of caffeine. An energy shot has 114, 200 milligrams of caffeine. Energy drinks are usually sold in a can or shot. There is certainly no requirement to declare the amount of caffeine on the label on an energy drink may contain quinine, I'll just say that, which increase the amount of caffeine. They are not also FDA regulated, meaning the label with the ingredients may not be accurate. Caffeine can cause the following problems: anxiety, sleep problems, digestive problems, and dehydration. Between 2007 through 2011, the amount of emergency room visits related to energy drinks doubled. They are consumed by men. The most following by teens and young adults. It takes about 10 minutes for an energy drink to affect your heart. After drinking, they cause your blood vessels to restrict or get smaller. This affects oxygen delivered to heart. Has to work harder to push the blood vessels, and they get less oxygen. This causes your heart rate and blood pressure to rise. They have been causing of children having cardiac arrest after drinking an energy drink. Cardiac arrest is when your heart stops beating. Energy drinks have been linked to affecting the QT interval of the heart. The QT interval is the time it takes for the heart to recharge, and between beats, if it's unable to do this, increase the risk of heart rhythm problems.
So now we're going to focus on our diagram. And Tyler's going to read to you the symptoms of caffeine overdose.
The symptoms of caffeine overdose: rapid, shallow breathing, jitter, anxiety, panic attack, dizziness, nausea,
Elevated,
elevated, heart rate,
palpitations,
palpitation, insomnia, heart
arrhythmias,
cardiac arrest. Recommended dose of caffeine daily, 400 milligrams.
Consuming too much sugar. Some of the problems that you can have with consuming too much sugar are obesity, high blood pressure, which if left untreated over a period of time can actually lead to kidney disease, inflammation in the body, heart disease, visceral fat increase, basically that means belly fat, atherosclerosis, which is a fatty artery clogging deposits, type 2 diabetes, where you become insulin resistant, fatty liver, and poor dental health. There have also been studies that have linked high amounts of sugar to cancer and depression. The recommended daily added sugar intake for men is 37.5 grams, which is equal to 9 teaspoonfuls. For women, it's 25 grams, which is equal to 6 teaspoonfuls. And for children up to the age of 18 years old, it is 25 grams, which is 6 teaspoonfuls. When we're looking at comparing what a serving size is, for soda, 1 can is considered a serving size. And this 1 can is a 12 fluid ounce can. With energy drinks, they commonly come in a larger can, and most people do not just drink half of a can. This is 16 fluid ounces. It's actually considered 2 servings. So when someone is drinking 1 energy drink can, they're actually drinking 2 servings, and they don't even realize it. Now Tyler's going to show to you the different amounts of sugar that's contained in these drinks. And just to also point out, if your daily recommended caffeine dose is 400 milligrams, 1 serving of an energy drink can be anywhere from 150 to 300 milligrams of caffeine. If there's 2 servings in this, drinking 1 can could already put you in the overdose area of caffeine, especially if it's a 300 milligram can. If you drank the whole can, you would actually be consuming 600 milligrams of caffeine. All right, Tyler is now going to show you the amounts of sugar that's also contained in these. So Tyler, let's start with this one. Can you tell them what drink this represents?
This is the Monster energy drink. It has 14 teaspoons and 56 grams of sugar.
So there is 14 teaspoons in a Monster can energy drink, which is equivalent to 56 grams of sugar. And if you look at that, that is a lot of sugar that you're putting into your body. Tyler, what's the next one we're going to talk about?
We're going to be talking about the Red Bull energy drink. It has 92 teaspoons, 9.2 teaspoons and 36 grams of sugar.
37.
37 grams.
Mm-hmm. So 9.2 teaspoons in a Red Bull can, which is 37 grams of sugar that you're putting into your body. The next one.
Pepsi can. 10.2 teaspoons, 41 grams of sugar.
Mm-hmm. So in 1 Pepsi can, you can see a little over 10 teaspoons, 41 grams of sugar. That's a lot of sugar. And our last one, Tyler?
Mountain Dew,
20 ounce
20
bottle.
ounce bottle, 48.4 teaspoons, 77 grams of sugar.
So in one 20 ounce bottle of Mountain Dew, that's how much sugar you're putting into your body. And this was kind of a really good eye opener for us, because when you're talking about dumping this much sugar into your body, along with dumping an overdose of caffeine into your body in a small amount of time, you are really challenging your body to try and process this without it damaging you. And some of the case studies that they showed, one in particular was a 14-year-old boy who drank a Starbucks latte. This was all within a 2-hour time frame. He drank a Starbucks latte, a 20-ounce bottle of soda, and he drank a Monster energy drink, all within 2 hours. So if you think about that, he probably consumed well over this much sugar in his body in 2 hours, in addition to over 600 milligrams of caffeine. He went out to play basketball with his friends and collapsed in cardiac arrest and died. So that's why we wanted to demonstrate for our health expo the dangers of consuming too much sugar along with too much caffeine. Thank you.